This video was prompted by a meeting I had the other day with a new person who reached out to me for help with their child. And at the end of hearing the entire story, I asked a bunch of questions, and I wasn't sure, but I think there was a dual diagnosis there. Dual diagnosis was when you have a substance abuse issue and you have another diagnosed mental health care issue, right? So there's two things going on there. And I told her, I said, I'm not sure what came first, the chicken or the egg. And what I mean by that is, I have a feeling after listening to this story and asking questions that the mental health issue, the dual diagnosis, happened first. I think she's had some I hate the word mental illness because it's just so inappropriate, I think. I have to use it all the time, but the differences, the different way of thinking, her mental health was the first thing that happened. And then she started drinking and using to treat that issue that was undetected. That happens a lot. And I think she started drinking and using drugs to treat the underlying problem, the primary problem at the time. Unfortunately, this takes off on you and progresses rapidly, and it becomes the primary issue, and this is the underlying issue. The one thing I know, which is what I told the person I was talking to, I'm telling you right now, if you're dual diagnosed and you treat your mental health issues with drugs and alcohol, the whole thing is going to change on you. Your alcohol and drug use is going to become the primary issue now, and the other is going to become a subtopic. I don't know what the word is. I haven't had coffee yet. Forgive me. I just wanted to get on and say this really quick. The big point here that I need you to know is that you can do nothing about the original mental health issue until you treat the substance abuse. So if you think you're drinking and using and you say it's because I'm anxious, I'm bipolar, I'm depressed, I'm this, I'm having panic attacks, all of that, you have to take care of this, the alcoholism, the drug abuse, the prescription drugs, whatever you're using now that you're now addicted to and cannot stop on your own. You have to address that first so you can properly treat the other underlying issue, right? When you treat the substance abuse, a lot of those other issues are going to go away. You might still have some, but they're not going to be as bad as they are now, because what you've done is you've taken a mental illness and you're treating it with another mental illness. And so now you've just cycled the thing out of control, right? And you can't quit. This is very hard when you have mental illness to understand this, because you keep thinking it's the mental illness. But the drugs and alcohol are making the problem worse. They will kill you. And nobody can help you. You can be on all the meds you want for OCD, BDD, schizophrenia, bipolar, whatever that is. But the medicines aren't going to work. They're not going to work right unless you take care of this. If you're drinking on your meds, you're perpetuating the problem. Most places you go into, if you're dual diagnosed and you go into a treatment center, they will address the alcoholism and drug issue first. They will help you with that first, and then they will treat the underlying issues. And before you leave, you'll have a plan. This isn't something you can just do yourself, self-medicate and self-regulate. All right? So reach out for help. If you need help, you don't know what to do, and this resonates with you, DM me, and I'll point you in the right direction. I'll walk you through it. I'm here for you. Thanks.